1 out of 5 people has urticaria at least once in their lifetime, meaning it is an extremely common condition. The main symptoms of urticaria are red, itchy welts on the skin, with the primary characteristic being itchiness. This condition typically occurs when a person eats nuts, shellfish, eggs, or other high-allergy foods. Sometimes, the body overreacts, leading to an allergic reaction on the skin. This reaction is due to mast cells, which normally should fight infections, being falsely activated. They release histamine, which dilates blood vessels, causing redness. Fluid leaks from the dilated blood vessels into the tissues, causing swelling, and the histamine irritates nerves, leading to itchiness. The classical presentation includes red, swollen, itchy welt on the skin, all due to the release of histamine from mast cells. Hives can appear and disappear suddenly, usually within hours, but sometimes they can last for days or even weeks or months. In these cases, it is called chronic urticaria. The most common triggers for urticaria include foods such as eggs, nuts, milk, chocolate, soy, and any other potential allergen. Medications, environmental temperatures, and even stress can also cause urticaria. People with urticaria have an increased chance of developing autoimmune diseases like rheumatoid arthritis and thyroid diseases. Moreover, urticaria can trigger a life-threatening condition called anaphylaxis, which requires an epinephrine injection, a life-saving intervention. Urticaria usually resolves itself within a few days or weeks, even without treatment. If urticaria spreads deeper into the skin, it is called angioedema. A classical example of angioedema is when a person eats peanuts and experiences swelling of the face and lips. If angioedema spreads to the throat, it can be life-threatening and requires immediate intervention. Anaphylaxis is a more systemic allergic reaction than angioedema, causing low blood pressure and bronchial constriction, and it can be fatal. Treatment for urticaria includes non-sedating antihistamines as the first line of treatment, such as Claritin, loratadine, fexofenadine, and cetirizine. Sometimes higher dosages are required than the standard dosing. If the first line of treatment doesn't work, H2 blockers like famotidine and ranitidine are used, and sometimes corticosteroids like prednisone, but only for a short term due to the risk of side effects. Home remedies, such as cool baths, wearing loose clothing, and applying calamine lotion, can provide some symptom relief. Adding colloidal oatmeal to lukewarm bath water can also have calming properties. In cases of throat angioedema and anaphylaxis, the only life-saving drug is epinephrine injections, which relax the airways and constrict blood vessels, improving breathing and increasing blood pressure to help with anaphylaxis and throat swelling. It is injected intramuscularly via auto-injector epinephrine pens. The best prevention of urticaria is to identify and avoid triggers, usually food.